My name is Justin Hare. I'm an interventional pain physician at Vitruvian Health, Interventional Pain. So I was originally born in Rome, Georgia. When I was 10 years old, we moved to Cleveland, Tennessee, so just north of where we're at now. I went to middle school, high school in Cleveland. I graduated from Bradley Central High in Cleveland. After I graduated high school, I went to Belmont and spent 4 years at Belmont University. I was fortunate enough to play on the basketball team there and graduated from Belmont. From there, went straight to medical school at Lincoln Memorial University, DeBusk College of Osteopathic Medicine. Spent 4 years there in medical training. From there, went to the University of Kentucky, where I did my residency in physical medicine and rehabilitation for 4 years, and then did an additional year at the University of Kentucky and specializing in interventional pain management. So growing up, I came from a healthcare background. So my mom was a nurse, my father was a chiropractor, so we were around healthcare quite a bit. So we were exposed to their professions and different things. My dad was a big proponent of going on to be more of a medical professional and do a doctor of osteopathic medicine to give you more opportunity. So the difference between a DO and MD are, as far as practicability and what you can do, there's not a big difference based on your specialty and what you specialize in. But the DO training is a little bit different in medical school, where we learn about 200 hours of hands-on kind of manual manipulation and manual therapy outside the normal medical training. And so it just provided us with a little bit more of a hands-on approach and osteopathic manipulative treatments that we can do. So interventional pain management, what we do is take a multimodal approach to your pain. We use different treatment options, including medication, different types of therapies, including physical therapy, occupational therapy, chiropractic care, acupuncture. We use different procedures or injection-based therapies and some small surgical interventions with the goal to improve your function and alleviate pain. So probably the biggest things that we see day in and day out are spine-related issues. So that would be neck pain, or neck pain radiating to the arm, mid-back pain. Obviously, low back pain is a big debilitating disease in our country, so we see quite a bit of low back pain radiating to the extremities. We also see a lot of chronic joint issues, whether it be knee, shoulder, hip pathology. So those are probably the most common things. Our goal is to use the interventions and therapies and non-controlled medications to try to alleviate the pain, but we still have the option of using the other medications if we need to get to that level. The way we were created and made, the body's miraculous, so we want to kind of facilitate the body healing itself by doing interventions or using medications to try to help that. And if that happens, that's great. That's kind of one of the better options in pain. We get rid of the pain and you're able to function and do that. But ultimately try to improve quality of life and improve function. That's kind of what we strive for on our daily practice. Favorite part is, the patients, trying to, figure out a way to help them alleviate or improve, the pain they're dealing with on a daily basis. Pain management can be difficult. There's not always a cure or an easy, simple, fix to alleviate someone's pain long term, but there's a lot of things we can do to improve quality of life. And I really enjoy being able to intervene with a patient, see them improve or get better, and kind of follow along their progress. So what I would like you to know about me is, personally, I try to, obviously listen to the patient. Our goal is to try to help you the best we can, so I want to do everything we can to try to improve your quality of life, help relieve, whatever pain you're dealing with, and, do it with, compassion and care, and make you feel like, we're really trying to make a difference in your life.